Hello everyone, I'm Dr. Aditya Sai. Welcome to our channel, the Shoulder and Knee Clinic. So today we will explain regarding the recovery from a shoulder arthroscopy. So firstly, what is shoulder arthroscopy? Essentially, arthroscopy is a process in which through small cuts around your shoulder, we put the instruments inside the joint, we visualize the problems and treat them. So shoulder arthroscopy essentially is a minimally invasive surgery. Through small cuts around your shoulder, we are able to manage all the problems inside. Since it's a minimally invasive process, your recovery is quite fast. Typically on the same day of the surgery or the next day, majority of people are discharged from the hospital. They can start using their hand immediately. So typically for activities like writing, typing, eating with a spoon, fork and knife, immediately it can be started. Now whether you are able to lift the shoulder or not, that depends on the kind of surgery that has been done. For surgeries which are small like acromioplasty, debridement or tenodesis or a tenotomy of the biceps, you can start moving your shoulder immediately, and typically by 4 to 6 weeks you will get the complete movement of the shoulder. However, if we have done some other surgeries like stabilization of the shoulder, like a bank cart repair, or if we have done repair of a rotator cuff or a muscle tear, in these situations initially only with support you are allowed to lift your hand. What we need to understand about shoulder surgery is that it gives you very good long-term results, but initially with procedures where shoulder stabilization is done or where a rotator cuff repair is done, we go stage wise with regards to the rehabilitation, and we have a protocol in place for that. This is because these are reparative surgeries. These are not artificial surgeries. We need to let the tissues in the body heal before loading them. Let's say typically after a rotator cuff repair, immediately with the help of physiotherapist and support, you can start lifting your shoulder up also till 120 degrees, and by 3 weeks you can progress to complete lifting of the shoulder with the help of support. After 6 weeks, initial brace which was put, that is discontinued, and you can start lifting your hand, and it takes around 3 to 4 months to get the full movement of your shoulder. Getting a full strength on the shoulder takes more time, and typically after 6 months you can lift any weight which you want, and you can do all activities which you want to do. In case of stabilization surgery, the recovery is faster, and generally by around 2 to 3 months you are able to move your shoulder fully, and by around 4 months you can resume sports. So shoulder surgery, although initially there may be a lag period, especially with regards to surgeries like a rotator cuff repair or with a stabilization surgery, in the long term they will give you excellent results with low risks of recurrence. Now, as a result of the fast mobilization which we do in shoulder surgeries, if you do a desk work, within a week you can resume your activities. You want to attend classes, you want to work on your laptop or computer, or you want to attend your office, definitely you can resume that within a week's time. Wearing your shirt, taking a bath, initially we put a waterproof dressing, so you can take a bath over that. You can wear your regular shirt and go to office, so all that is not an issue. The other issue sometimes women face, specifically like tying your hair or reaching behind for the buckle, so that takes slightly more time, around 2.5 months. So it's a quite fast recovery, and eventually you get the complete movement in the shoulder. So this is a brief about the recovery post shoulder surgery. So you may initially experience a bit of swelling around the shoulder, since in arthroscopy we pump fluid inside the shoulder to do the procedure. As you do the physiotherapy, your swelling settles down. The other aspect of recovery is pain relief. So a lot of patients undergo shoulder surgery for pain control. So when we talk about minor procedures like acromioplasty or debridement, pain relief is quite drastic, and typically within first 1 week majority of the pain goes, and by 6 weeks individuals are pain free. When we talk about rotator cuff repairs, within first couple of weeks the daytime pain which people are experiencing, that decreases significantly, and generally by 3 to 4 weeks there is no daytime pain. The nighttime pain can take again 3 to 4 weeks to go completely as we start the movement of your shoulder. Getting a strength, as we discussed before, depending on the type of surgery, whether it's a stabilization surgery or rotator cuff repair surgery can take variable amount of time. But when it comes to smaller surgeries like acromioplasty, biceps tenodesis, typically by 2 to 3 months you should recover the complete strength of your shoulder, and then you can start the gym and those activities where you're lifting heavy weights also. So this was a brief regarding shoulder surgeries, the recovery. So if you like what we saw, then share and subscribe to our channel and follow us. Thank you.